Autism. What is it? Have you ever heard about neurodevelopmental disorders? What about neurodiversity? Chances are you've heard about one or the other on your social media or podcast. But let's go deeper into this subject. Neurodiversity is a concept that defends that an atypical neurological connection is a manifestation of human difference, meaning people who have a neurological development or functioning differently from the socially expected pattern by society in general. A neurotypical individual is an individual who has neurodevelopment considered regular. Today we'll be focusing on Autism Spectrum Disorder, or ASD, a neurodevelopmental disorder characterized by deficits in social communication, restricted interests, and repetitive behaviors. Autism Spectrum Disorder, or ASD, is a disorder identified in childhood, and there's no cure available for it. But with treatments, we can improve the quality of life of those afflicted with it. But why spectrum, you might ask? Isn't it just a neurological condition? Well, it might seem so, but it's a lot more complex than that. This disorder is classified as a spectrum precisely because it manifests itself in different levels of intensity. Let's start at the beginning. In 1943, psychiatrist Leo Kanner published a study revealing 11 cases of children with extreme isolation from early ages of life and an obsessive desire to repeat actions. He observed that these children presented motor mannerisms and aspects that are not used in communication, such as the inversion of pronouns and the tendency to echo. In the following year, a new study was published in Germany by Dr. Hans Asperger, where he describes how mainly boys are affected by it and present lower empathy and intense focus. These studies were mostly left aside, as everything else was, due to the beginning of the Second World War. It was only in 1952 that the American Psychiatric Association published the first edition of the Diagnostic and Statistical Manual of Mental Health, DSM-1, citing autism as a childhood schizophrenia subgroup. And 26 years later, the psychiatrist Michael Rutter classified autism as a disorder of cognitive development. Only in 1980, this new classification entered the third edition of the Diagnostic and Statistical Manual of Mental Health, DSM-3, as an intellectual developmental disorders, IDD. And finally, in 1981, the psychiatrist Lorna Wing developed the concept of autism as a spectrum and coined the term Asperger syndrome, a nod towards Hans Asperger. Her work revolutionized how people saw autism. She influenced the world as a researcher, a clinician, and a mother of an autistic child. Since then, a lot has changed, and today, on June 18th, we celebrate Autistic Pride Day. There are some curious facts related to autism that are worthy of knowing. Did you know that studies show that due to the different neurological development of boys and girls, autism is more prevalent in boys because the female brain is more tolerant to genetic mutations, thus generating a protection against the development of autism? On the other hand, autism in girls increases the risk of epileptic events. To be clear, there are no differences between the brain anatomy of people with and without autism, but people with the disorder have a delay in brain connection due to an excess of synapses. Nowadays, autism can be classified as mild, moderate, or severe depending on the necessary support the autistic person needs to carry out day-to-day activities, and the set of behaviors that affect each individual in a different way and degree with a wide variety. But what causes this condition? There has been a lot of debate around this issue. We know that there are multiple etiologies of autism. Theoretically, some explanations point to organic causes, and others attribute it to the psychological character. Some authors suggest that biological and genetic factors are responsible for ASD, while others believe that hereditary disorders or ambiental factors could explain the spectrum. The bottom line is that studies on the etiologies of ASD are still inconclusive, and little is known about this condition. But what do autistic people have that makes them different from neurotypical people? It is possible to observe some specific behaviors in children who have ASD. Some variations can occur in each individual. The changes can be mild, moderate, or complex. In some situations, substantial support may be necessary, as the individual may have severe intellectual disability in conjunction with stereotypes, repetitive movements, difficulties in visual interaction, or even extreme problems with oral and written language. In more severe cases, autistic individuals may lack oral speech and not respond to external stimuli. Let's discuss some behaviors of children who have ASD. There are some behaviors that are important indications of the presence of autism and should be observed. Some signs of autism may appear as early as a year and a half, or even earlier in more severe cases. The child may resist cuddling or physical contact, make little or no eye contact, show little or no expression in response to the mother's or father's smile, rarely shows facial expressions appropriate to the situation, may be slow to start talking, or repeat word by word what others say with no real understanding of its meaning. Kids are less likely to use toys or other objects to represent people or real life in play, or may be obsessed with some activities, performing them repeatedly during the day. They may have unusual or intense but restricted interests. They can also be very sensitive or insensitive to sensory stimuli such as smells, sounds, lights, textures, and touch. Some children may demonstrate extreme food selectivity. Some types of food are rejected by children with ASD. There is an active refusal of vegetables, especially when offered raw. It is also possible to observe a restriction related to the texture of the food offered, which can be rejected when presented to the child in one way and accepted in a different texture. There are variations of this behavior in each individual, but the most important aspect of socialization common to autistic individuals is the need for a routine. Routines don't come with surprises, thus making life easier for autistic people. Routine is essential, as it prevents them from feeling insecure, confused, and engaged in unwanted behaviors. In some situations, substantial support may be necessary, as the individual is characterized by the presence of intellectual disability, along with stereotypes, repetitive movements, difficulties in visual interaction, and important problems with oral and written language. The psychological treatment with the best evidence of efficacy, according to the American Psychiatric Association, is behavioral intervention therapy. The treatment for autism is personalized and interdisciplinary. Apart from psychology, patients can benefit from speech therapy and occupational therapy, among others, according to the needs of each autistic person. At school, a mediator can be crucial to mediate social interaction. Some symptoms, such as irritability, agitation, aggressiveness, hyperactivity, impulsivity, inattentiveness, insomnia, and others can be treated with medication, which must be prescribed by a doctor. In addition, it is important to emphasize that the sociocultural and affective environment of the child with ASD should be enriched with social activities. These situations may trigger a variety of stimuli, which can be very challenging to deal with if you don't have the proper tools to solve the conflicts and stop meltdowns. So it is really important that the parents are already oriented on ASD. Likewise, interaction with other children of the same age group provides social contexts that allow an exchange of ideas, roles, and the sharing of activities that require interpersonal negotiation and discussion for conflict resolution. Despite the challenges that such a simple activity may bring, it is possible to improve their social skills, understanding that this type of disorder compromises the social development of some children from the very first years of life. We've talked a lot about autism. We also mentioned that there's a spectrum, right? Let's talk about another autistic aspect, known as Asperger's syndrome. It is a change in the patient's development that ends up affecting their socialization skills, their contact with the outside world, and their ability to communicate or express their emotions. Asperger syndrome is included in the scope of the Autism Spectrum Disorder. It is considered one of the mildest forms of autism. The signs of Asperger syndrome are many and can vary considerably with each child. Many people reach adulthood without being diagnosed. The most common symptoms seen in individuals with Asperger's syndrome are normal intellectual and cognitive development, but with some difficulties with imagination or more abstract thoughts, normal or even above average intelligence, development of very specific skills and talents, and sensory hypersensitivity. Since it is a spectrum of autism, there is no cure or treatment for Asperger's syndrome. Depending on the symptoms that are presented, support from psychologists and other specialists might be necessary to learn strategies and techniques to improve the quality of life. Today's topic was the autism spectrum. Let me know in the comments if you know anything else about this disorder. We would love to hear about the experiences of our autistic subscribers.